The WHO has declared the Ebola outbreak in the Democratic Republic of Congo as a public health emergency of international concern. At least 80 people have died from the disease, as 2 cases were reported in neighboring Uganda. Dr. Manenji Mangundu is Oxfam International's DRC director, and he joins me now from Bukavu in the eastern part of the DRC. Good to have you with us. Doctor, firstly, how concerning is this outbreak for residents across the DRC where you are?
Thank you very much for having me. Yeah, we are really worried because the emergence, the Ebola outbreak here, which is a different strain from the usual Zaire that we know, which is now Bunjo. There's no vaccines. So it's so worrying. And the infection is so spread within a very few days. I think we got to know about on Saturday early morning, and up to now, we have almost 401 cases that are suspected to be Ebola and 8 deaths so far. So it's quite a very big concern for everybody. And then this is in addition to the humanitarian crisis that we have and also the lack of resources that do exist within the country after humanitarian cuts that we have seen across most of the donor countries.
And because the WHO declared this as an outbreak of a public health emergency of international concern, is there how likely is the chance of this virus, spreading beyond the DRC and beyond Uganda, where we know there have been at least a few cases?
Yeah, if you look at Eastern DRC, especially Ituri province where the disease started, there's quite a lot of movements of populations. You understand that now the east of DRC is divided between the de facto government and also the government-controlled areas, and there are a lot of people movement across these regions. By this, we have noted as well that we have a case that came from Ituri that went to Goma, and that case has been identified, and they are busy doing the contact tracing. And also there's a lot of movement because of trade between that part with Uganda. So there's a lot of people that are moving between Uganda. As well, don't forget also, there's a lot of movement between DRC and Rwanda. So it's really of great concern, yeah? And we have flights from Ituri that are going to Kinshasa. And this is also another major worry, because once it's in Kinshasa, it's so overpopulated that it may be of really great concern for us. It will be difficult. So everyone is worried. But on top of that, I think measures have been put in place both by the government, African Union and the CDC, and us humanitarian workers, where we are now sending a lot of people there to actually go and start massive campaigns against this outbreak.
Yes, and tell me, for those who work for your organization, what are they doing when they get to hotspots there? What is the work that they're going to be doing to curb the spread of Ebola?
So our role, Ebola is mostly associated with the water and sanitation and hygiene. So our role there is to make sure that we engage with the health centers, we engage with the schools, we engage with the public, the general public, especially when they have cases of death, how we manage that to make sure that people are not in contact with the fluids, with the corpse of the dead body, to make sure that strict measures are put in control. And also making sure water is available to the villages that are affected, especially where there's the outbreak started. And also, Oxfam, we are involved in procuring large volumes of soap for distributing and hand washing facilities, so that at least we are creating massive preventive measures to make sure that the people will follow this through to limit the spread of this disease. We are also engaging what we call community engagement with the population that are affected to limit movements out of those zones, so that at least we first contain the outbreak before it can spread everywhere, including across the borders as well.
Dr. Mangundu, you spoke earlier about how funding cuts are impacting. What are those? Can you elaborate on where this shortfall in funding is coming from, and how is it going to be impacting the work that you and other organizations are going to be doing?
Yeah, I just want to give you an example. I think we had so much cuts that was done, for example, by U.S. government, and then the British government also announced they're cutting humanitarian funding. These are having an impact on your health, because they were supporting health care in a fragile situation where we have conflict, because East DRC is a conflict area which has been very fragile, with a fragile health system that is struggling to function. And the cuts that were done affected further because humanitarian actors like MSF, like Save the Children, like DRC, who were doing health care, supporting and strengthening health system in those villages that are fragile, have been cut. So people now had very limited access to the health facilities. And again, with Ebola, we need massive isolation, massive infrastructure, that the triage that controls the contacts when the patients report at the clinics, and the way we manage those patients at those health centers that where they are managing. I understand that the cuts, they are not just affecting humanitarian actors. They are also affecting the government, because the government is in war, under war. They have no capacity. They have limited capacity to actually respond if there are no resources that are coming in. So it's like majority of the people are exposed to death, because the fatality rate, as you have seen, 400 suspected cases and 80 are already dead. There are some statistics that the teams are going to actually collect, because the teams have started moving into those affected areas. There might be unreported cases of death and active cases already that are infected. So you can imagine, without resources, we will not be able to do that. And it also have a negative impact on the surveillance system, which actually, if we don't have resources, we don't have staff that will be able to go there and do the surveillance system.
Yes, it does sound like the DRC government will struggle in its work to contain the spread of the virus. What's required from the international community?
So what we require from the international community is to make available the resources. We are saying the United Nations agencies who are doing humanitarian, the international non-governmental organizations that are providing humanitarian assistance, we have access to some of these areas. We know the government in DRC have actually experts that are based in Kinshasa, but some of them cannot access these rebel-controlled areas. But we have access. So we want those resources to be provided by international community, so that we are able to actually save lives in those areas that are affected.
Yes, okay. Dr. Manenji Mangundu, we really do appreciate your time and wish you well with all the work that you're doing.
Thank you so much.